8 critical pancreatic cancer symptoms you should never ignore. Did you know that pancreatic cancer is becoming increasingly common in the United States? Although pancreatic cancer is relatively rare, its lethality is so concerning. By 2040, pancreatic cancer is set to become the second leading cause of cancer-related death in the country, trailing only behind lung tumors. Experts estimate a more than 65% increase in cases among Americans in the next 2 decades. However, there is good news. Thanks to scientific advancements, early detection, and appropriate treatments are improving recovery rates every year. Before we delve into the symptoms, let me ask you a question. Do you know where the pancreas is located and what its function is? For those who aren't familiar, the pancreas is a gland located behind the stomach. It plays a crucial role in producing insulin, which controls blood sugar levels, and in producing enzymes that aid in digestion. Now that we understand a bit more about the pancreas, let's address an important topic: pancreatic cancer. Pancreatic cancer is often referred to as the silent disease. This is because symptoms may take time to appear, especially when the tumor is located in the deeper parts of the organs. Unfortunately, this can allow the cancer to develop undetected for a long period. This type of cancer is more common in people over 60 years old and affects more men than women. Diagnosing it before the age of 30 is rare. Understanding the symptoms, even the most subtle ones, is crucial. According to Cancer Research UK, only 5% of patients survive for more than a decade after diagnosis. That's why early detection of pancreatic cancer is crucial for the success of treatment options. Let's now explore the 8 symptoms of pancreatic cancer that you should never ignore. We'll also delve into prevention methods and treatment strategies. Watch until the end because there's one symptom that might completely surprise you. Symptom number 1. Blood clot. A blood clot in a large vein, often manifesting in the leg, can sometimes be the first signs of pancreatic cancer. Known as deep vein thrombosis (DVT), this condition's symptoms include pain, swelling, warmth, and redness in the affected area. While not the most common cause, pancreatic cancer's association with blood clots like DVT warrants attention. Although pancreatic cancer is not the most common cause of blood clots, it is important to be aware of this possibility as most blood clots are caused by other conditions. When a blood clot forms in the lungs, for example, it can cause additional symptoms such as difficulty breathing. 2. Yellowing of the skin and eyes (jaundice). Characterized by a noticeable yellowing of the skin and eyes, jaundice is a common early symptom in most pancreatic cancer cases, particularly in biliary cancer. This condition results from an excess of bilirubin, a brownish-yellow substance the liver produces under normal conditions. Bilirubin is transported by bile through the common bile duct to the intestine, aiding in fat digestion. However, a blockage in this duct, often caused by a tumor in the pancreas's head, prevents bile from reaching the intestine, leading to bilirubin accumulation in the body. Cancers that start in the head of the pancreas can press on the common bile duct, causing jaundice even in early stages. However, tumors that begin in the body or tail of the pancreas usually only cause jaundice when they have already spread, often affecting the liver. In addition to yellowing of the skin and eyes, other signs of jaundice include dark urine, pale or greasy stools, and skin itching. 3. Persistent back pain. Have you ever experienced that slight back pain that seems to be just a passing discomfort but persists longer than expected? Sometimes this pain can be more than just a simple muscle strain or a spinal issue. In the case of pancreatic cancer, it can be an early sign. The pancreas is a relatively small organ shaped like a carrot, about 15 cm long and less than 5 cm wide, that is tucked away between the ribs and the stomach. When a tumor develops in the pancreas, it can exert pressure on nearby organs or affect the nerves around it, causing back pain, especially in the lower back. 4. Abdominal pain. Now let's talk about abdominal pain. Just like back pain, this can also be a telling sign of issues with the pancreas. Pancreatic cancer can cause pain in the upper abdomen that radiates to the back. It may come and go, but it's important to pay attention to these signals. As the tumor grows, it may begin to press on other organs, triggering this pain. 5. Nausea and vomiting. When a tumor presses on the stomach, it can lead to partial blockages, making it difficult for food to pass through. The result? Nausea and vomiting, symptoms that may indicate issues with the pancreas. Some people may also experience abdominal bloating and feel full quickly during meals. These signs may be related to the pressure the tumor exerts on neighboring organs. If you notice any of these persistent symptoms, don't hesitate to seek medical help. Early detection is crucial for effective treatment. Liking our video so far? Before we move on to the next pancreatic cancer symptom, don't forget to like, subscribe to the channel, and enable notifications. Your interaction is essential to strengthen our community and disseminate knowledge. 6. Unintentional weight loss. Stepping on the scale and not noticing a few pounds shed effortlessly. That's a dream for many people. However, when weight loss occurs without any effort on your part, it's time to pay attention. While it's normal to lose a few pounds after stressful periods such as changes in personal or professional life, unintentional and unexplained weight loss can indicate an underlying health issue. In the case of pancreatic cancer, unintentional weight loss is a common symptom. It's often associated with a lack of appetite or early satiety that we discussed earlier, and may be accompanied by feelings of fatigue and weakness among other symptoms we will discuss. 7. Fatigue and weakness. Individuals diagnosed with pancreatic cancer often experience persistent fatigue or physical weakness regardless of their level of physical activity. These feelings may be linked to difficulty in sleeping and a depressed mood. The crucial role of the pancreas in producing enzymes necessary for food digestion can be compromised by pancreatic cancer, affecting the body's ability to obtain the necessary energy. It's important to remember that fatigue is a common symptom in various types of cancer, not just pancreatic cancer or even other health conditions. 8. Diabetes. Yes, you heard right. Diabetes emerges as a particularly significant indicator. As mentioned earlier, the pancreas plays an essential role in insulin production, and it's natural that cancer affecting this organ can influence blood sugar levels, leading to the development of diabetes. However, it's crucial to understand the complex relationship between diabetes and pancreatic cancer. While pancreatic cancer can cause diabetes due to its impact on insulin production, existing diabetes, especially when poorly controlled, may also increase the risk of developing pancreatic cancer. While it's still not entirely clear, several studies suggest that a recent diagnosis of type 2 diabetes may be an early indicator that cancer could develop. To illustrate this, let's consider some important studies conducted by renowned institutions. A landmark study in 25 involving 122 residents of Rochester, Minnesota, shed light on the intricate relationship between diabetes and pancreatic cancer. This research found a significantly higher likelihood of individuals diagnosed with diabetes developing pancreatic cancer in subsequent years. Another research led by the University of Auckland School of Medicine in New Zealand examined around 140,000 people with type 2 diabetes or pancreatitis. The results revealed that those who developed diabetes following pancreatitis had a seven-fold increase in their risk of developing pancreatic cancer. These findings are crucial as they indicate that early diagnosis of diabetes may present an opportunity to detect pancreatic cancer at early stages, thus improving the chances of effective treatment. Wrapping up our discussion on pancreatic cancer, it's important to emphasize that having one or more of the mentioned symptoms doesn't necessarily mean you have this disease. Often these symptoms can be caused by other health issues. However, if you are experiencing these signs, it's crucial to seek medical attention for proper evaluation and treatment if necessary. What are the causes of pancreatic cancer? The exact cause of pancreatic cancer is still unknown, but there are several significant risk factors to consider. Smoking, for example, is one of the leading risk factors, significantly increasing the chances of developing the disease. Additionally, obesity, excessive weight gain in adulthood, and family history can also play a role, including hereditary genetic conditions. But if we analyze these risk factors excluding the hereditary factor, we realize that many of them are within our control. Therefore, don't smoke. Smoking is the most important avoidable risk factor for pancreatic cancer. Quitting smoking helps reduce the risk. If you smoke and want help quitting, talk to your doctors. Monitor your diet, body weight, and physical activity. Maintaining a healthy weight can help reduce the risk, and thus it's always recommended to engage in physical activity and watch your diet. The American Cancer Society recommends following a healthy eating pattern that includes plenty of fruits, vegetables, and whole grains and limits or avoids red and processed meats, sugary drinks, and highly processed foods. And lastly, but certainly not least, it's crucial to avoid excessive alcohol consumption. Prolonged and excessive alcohol use can lead to the development of diseases like chronic pancreatitis, which in turn significantly increases the risk of developing this devastating disease. How to detect pancreatic cancer. Diagnosing pancreatic cancer typically involves evaluating symptoms, laboratory tests, and imaging studies such as ultrasound, computed tomography (CT), and magnetic resonance imaging (MRI). In some cases, a biopsy may be necessary to confirm the diagnosis. Despite the challenges, there have been significant advances in the treatment of pancreatic cancer in recent years. Early detection of the disease considerably increases the chances of cure, and surgery is often the first treatment option when the tumor is detected in its early stages. For more advanced cases, chemotherapy, radiation therapy, and even immunotherapy may be considered, offering hope for patients. Although discussing diseases, especially cancer, can be difficult, it's crucial to start this conversation because early detection and proper treatment can make all the difference. Pancreatic cancer is treatable, and seeking help early can result in better outcomes and even cures. We hope you found this video helpful. If you have something to add, please share it with us in the comments section. Give this video a thumbs up and share the link with your family and best friends, so they also will know the 8 critical pancreatic symptoms that cannot be ignored. If you're new to our channel, don't forget to subscribe to support our growth and hit the notification bell to learn more about preventing and safeguarding yourself against cancer. Watch these 2 recommended videos popping up on your screen right now. Thank you for watching. Stay healthy. Bye.